And we must do it. I have to do a disclaimer because right now, guess what? There are still our hospitals and there still are doctors, and she's going to.
Any and all information put forth by Dr. Bones and Nurse Amy is for informational and entertainment purposes only. The practice of medicine or dentistry is illegal and punishable by law. Dr. Bones and Nurse Amy strongly urge their audience to seek modern and standard medical care whenever and wherever it is available. Please.
So as I said yesterday, if you need a brain transplant, there's a hospital with a brain surgeon over there. Don't try to do it yourself.
Assume you
All
have a
right,
brain.
now the lovely Nurse Amy is going to talk to you about burns.
Okay, so basically burns are divided up by degrees, and by the degree is by the depth. So first degree involves the top layer of your skin, which you can see, is the epidermis. Underneath that is the dermis. Then you have the subcutaneous or fatty layer, and then you have the muscle. So in a first degree, you have superficial burns, and it generally looks like this. Typically a sunburn. It could be a mild water scald also. If it's oil, it's generally going to sit on the skin a little bit longer, and you're probably not going to have just a first degree from the oil. So, treatment for the first degree. For all of them, cool water. Do not put ice on it. You could cause further damage to the skin that has been burned by putting ice on it. So you want to get it in cool water. If you don't have ice, if you don't have actually a bath to just soak it in, let's say you're in a river or a stream, or you just have water bottled, then just pour the water over it. But you want to keep constantly pouring the water on. You need at least 10 minutes of cooling off before you do any treatment. It's the first thing you do. Leave it uncovered. First degrees don't need to be covered. If they're not blistered, don't cover them. Anti-inflammatories, pain medications like ibuprofen, that will help decrease the redness, the swelling, and also the pain. You can spray them with some Dermablast or benzocaine sprays. You can take antihistamines during the healing process. You do get some itching, so that could help decrease the itching. The number one hospital-used treatment for burns is Silvadene. However, I prefer lavender oil, tea tree oil, aloe vera, and my mother's favorite treatment of my burn was vinegar. I smelled like a salad half my life because I grew up in South Florida and we went out all the time, so I got burned. My mother would put vinegar in a bath, which you can do also, and soak, and it actually pulls the burn away. Vinegar is awesome.
White vinegar?
For burns. Also, in that initial cooling off period, you can put vinegar in the water that you're cooling it off. And my daughter just burned her hand with some boiling water a couple weeks ago, and that's exactly what she did. She called me 10 minutes later, Mom, it feels better. The vinegar works. When you go to sleep at night, you can soak a t-shirt in the vinegar water, squeeze it out, and go to sleep with it. It will keep that burn. Because I don't know if you guys have slept with first degree burns on your body, but all night long you are hot and sweaty. And what that cool t-shirt does is it allows you to pull off the heat and stay cool and actually get some sleep. Also, the tannin in tea bags. You can either put the tea bags and steep a tea and then soak the burn in tea, or you can make compresses and actually apply larger areas with the tea. The tannins are very good to draw heat from, and witch hazel works. You don't really need to use raw honey on first degree, but it is also an alternative if you want to try it. But everyone thinks that the aloe vera and the lavender oil, just don't forget the vinegar. Works very well. The tea tree oil, if you have oils, you probably have both of them. Go ahead and just blend the tea tree and the lavender. It'll work well. All right, so now let's go to second degree. So now you've moved through the dermis and you're into the second layer. Usually the second degree burns appear blistered or watery. You can see this kind of looks a little wet. The blisters may have popped, but this is generally what second degree burns look like. And they're extremely painful. Second degree burn treatment. Again, you're going to use the cool water. Use a little bit longer if you can do it 15, 30 minutes. That would be great. Remove all the rings and bracelets. Sometimes second degree burns, you get swelling. So you want to remove all the jewelry, anything that's constricting around that area. Also, again, anti-inflammatory medicines help with pain, and antihistamines with healing. If the blisters are small, don't break them. Just leave them. That is a barrier. Every time you open up a barrier, you may allow bacteria to get in there and get an infection. So that skin actually protects the burnt area and allows it to heal. This is where I love honey, because honey actually prevents bacteria from getting into the injured area. It's a perfect environment for skin to heal. That honey consistency, your skin granulation, which is the healing tissue, works much better in that kind of environment. So the honey, you just spread it over it. Use a non-stick gauze. It's also called telfa, but it's non-adherent. So you make sure while the tissue's healing, it doesn't grab onto the gauze. If you want to just use the honey, just keep using it and using it and using it until that skin is healed. It works very, very well. Again, you can also, as an alternative, use triple antibiotic healing cream. Again, you want to cover it with telfas. Cover it loosely. You don't want to tape down telfa because you need some looseness. That skin needs to grow and heal, and you don't want to sort of make it so airtight. So just loosely cover it. And increase fluid intake and watch for shock. Again, the blisters and the oozing, you're going to be losing fluid. It depends on the size of the burn. If it's a very large area, you're going to lose a lot of fluid. So these people really need to be hydrated well. Okay, third degree. Now you're moving down lower. Not only have you gotten the epidermis, but you've gotten rid of the dermis, and now there's probably some of the fatty layer left, but it could be gone also, and all you see is a deep hole when you see into the muscle, and it's possible even the muscle can be burned. This is very, very dangerous. These are the people that right now, if you have a hospital system, they have to go. There's no choice. What we're talking about treating right now is if there is no hospital to go to. This is what it could look like. It can be charred, it can be white, it can be gray, it can be black. It just depends on the layer of the burn, but it looks pretty bad. Also, third degrees. We talked about mild pain with first degree, pretty severe pain with second degree. Third degree, guess what? You have burned out the nerve endings. It may not be painful at all. Now, it's going to be when it heals, when those nerve endings start regenerating. But at first, somebody may walk up to you and say, you know, I burned my hand. This looks kind of funky. And you look down into a hole. And they're not screaming. They're not crying. They're just sort of in shock. These are very severe situations. You don't want to stick that in water. You want to have a running water. You want to be pouring the water over it, not soaking it. You want to remove all clothing, rings, and jewelry. Third degree burns usually have severe swelling. You have to get all the constriction off as quickly as possible. Elevate the burn. If it is an extremity, get the arm up. It's going to start swelling up pretty quickly. If it's a leg, elevate it. You want to do everything you can to keep the swelling down. Hydration, extremely important. You have to remember you now have a hole. And guess what? All those little capillaries that are dripping is going to keep filling up with fluid and filling up with fluid and filling up with fluid, basically until it heals. So you're going to be losing fluid. You need to put it in. If this person is conscious, if they can drink, hydrate, hydrate, hydrate. They have to keep drinking, and not just straight water. I would definitely be giving them some rehydration fluids too, whether it's Gatorade or rehydration salts, because they're going to lose their electrolytes. So you need to replace those. These people, again, we're talking about out of hospital. There is no burn unit they're in. they need antibiotics. They have a hole in their skin. Your body, your skin is your armor. Every time you chink it, whether it's a little cut or a big severe burn, that's where bacteria can get in, okay? They need antibiotics, especially without a burn unit. They're probably going to need pain medicine again. As those nerves are regenerating, they're getting tingly, they're getting stimulated. It is very, very painful. If anyone's ever worked in a burn unit or known someone who's healing from that, it's extremely painful. So you get them the strongest medication you can. The only herbal recommendation that I have for you without a burn unit, with someone with a third-degree burn, is after the cooling off, to immediately get raw, unprocessed honey into that wound. Fill it up, overflow it, put a plastic wrap over it, like plastic wrap, and saran wrap, that's what I was thinking, saran wrap. You want the edges overflowing. Every day, pour more honey into it. You're not washing that honey out ever. That honey has antibacterial properties. Again, we were talking about the new tissue grows very well in that kind of honey environment. It has a low pH. It's going to help keep the bacterial infections away. This is the only treatment that I would ever use without a hospital for a third-degree burn. Raw honey. Just put it on and put it on and put it on. Don't ever wash it off. Don't ever expose that burn to the air. By continuously putting the honey in, you're protecting it. I would use the plastic wrap probably about 10 days. You're going to change that plastic wrap every day. All you're doing is taking off, putting more honey, recovering it. Now you can cover the plastic wrap with some loose telfa or loose gauze, roller gauze, just to keep the plastic wrap in place. But that's the only thing that I know that will work with a third-degree burn. And that's if you're lucky, because there is a high death rate for severe, large area of third-degree burns. There may be nothing you can do, but this is the one thing you can try. And that's all we can do is try if we don't have hospitals. So anyway, there is a serious risk of death from shock and infection from third-degree burns.